Hi, I'm Dr. Ray Gandhi, and today's topic of discussion is top heart health tips from a cardiologist. But before that, a little bit of introduction about me. I was born in India, and believe it or not, when I was in high school, I always wanted to go into computer science. I never wanted to be a doctor, but and I did actually apply for computer sciences, but my father and mother found out, and they said, "No, I think you'd be better off as a doctor." But I really didn't like medicine until I started reading cardiology. And that's what all I wanted to do. And I still tell students when I teach them that if our body didn't have a heart, I would be doing computer science. So here we go. The way to prevent heart disease is think of it as a global phenomenon. It's still one of the top killers of mankind. We can look at it as a primary and secondary prevention, which is only for individuals, or we take a broader view, which is primordial prevention. That's for the whole society. And the way to do that is to have ideal health factors and healthy behaviors. And we'll go into that in a next slide. So I'm sorry, this slide is very busy, but on the top of the slide, it tells you about how to go about reducing your heart risk, which includes proper diet, which is fruit, vegetables, nuts, legumes, exercise, and the way to go about it for the whole population is to tell people in a way that they can understand what are the heart healthy tips. Now, this could include what the rest of the people around you are doing, peer pressure, what kind of branding is being done. We always see, how smoking is cool, or the food from Carl's Jr. or other McDonald's looks so good, but sometimes that's not as healthy for you. And then we go down to primary prevention, in which we work with diet and lifestyle. And in some cases, you need medications to get that little extra bump to prevent heart disease. Now, the primary prevention is for people who never had heart disease before, but you're just preventing that from happening. And this is something new that we started maybe 10, 15 years ago, because before that we would just only do secondary prevention, which is after somebody had a heart attack. But then, now if you think about it, if somebody had a heart attack, maybe it's already out there, it's already happened, now what do? Don't need to do anything more. No, but you can prevent a second heart attack, or you can prevent a third heart attack. And that's where you need to work harder, so that if you just have only one heart attack all your life, you'll do fine. But if you have 2 or 3, then it starts to take a toll. Now, the way to go about is that, and I'm pretty sure you must have seen this slide before, is Life's Simple 7, which include no smoking, keeping a healthy weight, adequate physical activity, balanced, healthy diet, and then getting your cholesterol low, your blood pressure low, your blood glucose low. And for that, either you may go by diet, or sometimes you need medications. I'm sorry, this is again a busy slide, but it's ABCDE of healthy lifestyle. But we'll deal with individual topics one by one. So let's get into this. This is our healthy lifestyle, exercise, sports, fruit, vegetables, and all that. And again, we'll talk about it in the next slide. So how do we do this? We have 4 key lifestyle measures. Now, stop smoking. That's something that's really important, because that's the commonest reason where people would get heart disease. And we do have less people smoking now, but vaping is kind of taken over, which is a problem. And we don't know how bad it is, but as time goes on, as more studies are done, we'll find out. But so far, the early data shows that it's not as good as we thought it was. Of course, maintaining healthy weight, regular exercise, and healthy diet. So how do we go about that? Smoking cessation is not easy. It's hard to do, but we do have tools available to us. We have nicotine replacement therapies, which includes pills or patches, even inhalers. We have a nicotine inhaler that would kind of replace nicotine till you're trying to get out of your smoking habit. And there are other medications that actually help to take the urge of smoking away, which is also very hard. And believe it or not, it's actually the smell that gets people to start smoking again after they stop successfully. Now, if you look at that, 64% of the deaths in people who are a smoker are attributable to smoking. And even if you quit smoking, initially in the first 1 or 2 years, 28% of the deaths are due to smoking. Now, they may not be directly due to smoking, but the illnesses that smoking caused, including cancer, heart disease, stroke. Now, 20 years after you stop smoking, your risk becomes as low as if you never smoked. But it's better to start sooner than later because, if you start sooner, you don't have to wait 20 years to get the benefit. Maintaining a healthy weight is important. And for that, you should shoot for a BMI of 25 kilo per meter square. And there's calculators on the internet that you can use. You just put your weight and height, and it gives you your BMI. Waist size for men less than 40 and for women less than 35 is important. Now, if you just look at that, like after age 20, if you gain 11 to 20 pounds, you're 3 times more likely to get heart disease or diabetes, hypertension, gallstones. So, keep your weight down. And now this is compared to people who just only gain 5 weight, because you do gain some weight after you turn 20. You stop growing in your height and you start growing in your waist. So for the heart healthy diet, you want to avoid trans fat, which is typically, your cookies, processed meat, sugar sweetened meat, beverages, cakes, and then use more nuts, seeds, legumes, and vegetable sources of protein. And of course, unsaturated fat that come from plant is also beneficial. But again, quantity matters. So how much you should eat? So enough, like couple servings of fruit every day, fish couple times a week, and whole grains are important because that gives you the roughage and also helps your bodily functions. And avoid, if possible, sugar sweetened beverages, juices, etc. Water is best. And of course, processed meat is worse than that you can get unprocessed, but still keep it down to a couple times a week at the most. Now the diet is we know about Mediterranean diet, but this year and last year the new thing is called flexitarian diet, which is actually Mediterranean diet with less animal proteins, because the less animal proteins you take, the more benefit you get. But it's going to be hard for most of us to give up meat entirely, so a couple times a week would be good enough that your body gives, your body has chance to process it. Like everything else, there is an app for that. And this app was just released recently, and actually I've downloaded it. It's very neat. It asks you a few questions, and you tell them what you normally eat, and then it'll give you ideas about what changes you need to make for, let's say, if you want to lose 5 pounds, it'll tell you what changes you need to make with your diet. And also you can set goals, there's recipes, and it's all for free and it's for more tax dollars. The good thing about this is it's from USDA, so if things change, which they always change, every year there's something new, it's going to be incorporated in this app, and they don't ask you to upgrade or pay money to upgrade. Of course, no advertisements. So exercise, more than 150 minutes of moderate intensity exercise every week. Now, if you break it down, it's not that bad. Like, 30 minutes a day and you're there. Actually, you're beyond there. But if you don't have enough time, you can do vigorous intensity exercise. And also remember intermittent sitting, because most of us sit in front of the computers. So you just get up to do nothing, or get water, or go to the bathroom, get coffee, or just do nothing. But that's important. Every time you get up, your body, your muscles kind of start burning calories. Now, when you start vigorous intensity exercise, always start slow and build up on that. Don't just go for the gold medal the first day. Just go slow and go very slow. And you've not been exercising for a few months, you can take a few months to get in shape. Now, this is the timeline of how the cholesterol attacks your body. It starts when you're 16 years old and then slowly builds up. First there's a fatty streak and then it adds on and on. And on the right side, it shows how it causes a heart attack. As it builds up, the lining on top of the cholesterol plaque, which is the yellow part of that artery you see, is cholesterol. And there's a kind of white lining on top, which is what keeps the cholesterol away from your blood. But as it grows, it can crack at the edges, and that's where the clot can form and cause a heart attack. And that's why the heart attacks are sudden. You're fine, and then suddenly you get a heart attack because that plaque cracks, and then it clogs up the artery completely. So we do need medication in some cases, especially if somebody has diabetes, or if their bad cholesterol is very high. Now, if you have risk factors, then if your bad cholesterol doesn't have to be very high, it just has to be high, and you start treatment early. Or if your risk, and there's calculators out there that will tell your 10-year risk. So if your 10-year risk is on the high side or intermediate side, then you may want to treat with statin therapy. And if you're not sure, if you want to just find out, do I really have to take statins or not, because of the side effects or what I've heard on the news, then you can get a coronary artery calcium score. And if your coronary artery calcium score is high, which is a measure of how much atherosclerosis you have, then you can start statin therapy. Then you know that you're getting more benefit. And of course, there's some risk enhancing factors, which I'll talk to you at the end of the talk. If you have those, then you may need treatment with medications. But just because you're on medication doesn't mean you can pig out. You have to do the right thing, which is your diet and lifestyle measures. Now, aspirin, and most of you are probably aware of this, but there are cases where we do give aspirin, but it's not for everyone. But if you're high risk for heart disease, then you still would need baby aspirin for prevention. But you have to be sure that the risk of bleeding is low, because if you bleed, then you will lose all the benefit you're going to get. Blood pressure. And the definition keeps changing, and you have to keep up with that. But currently, you don't need medications if it's less than 130 or 80, and you're not at high risk. But if you're at high risk, then of course you got to treat that. Now, if you don't have any other risk factors, then you can be a little bit easy on taking the medication. But 140 or 90 does not mean that's your target. Then you start with your DASH diet and lifestyle measures. And you don't need medications, but you still have to do other things to lower your blood pressure. These are the risk enhancing factors, which is if you have family history of heart disease, then you need to be preventing it sooner than later. Don't wait, start early. If you have high cholesterol, which is, you should get it tested in your teenage years before you turn 20. And then you can institute lifestyle measures. And sometimes you need medication, but most of the time you can change what you eat to prevent heart disease. Metabolic syndrome is based on if you have high triglycerides, if you're overweight, if you have glucose intolerance, all of these combined together can be labeled as metabolic syndrome. You have to work harder. Kidney disease is one of the things that increases your heart disease. Other diseases like rheumatoid arthritis, HIV, AIDS, they all increase your chance of heart disease. So you have to start working harder, especially if you have those risk factors. It doesn't mean other people don't have to do anything, but you just have to work harder if you have these things. Premature menopause, or if you had preeclampsia during pregnancy, then you need to work harder. If you're Indian, you have high risk of heart disease, you work harder. And if you have other cholesterol besides the total cholesterol, like triglycerides, which is when they're higher and they're non-fasting, then you need to work harder. And sometimes you may need medications. Now, there's other things that you can measure that will also tell your risk, including if you have what's called high sensitive C-reactive protein, which is an indirect measurement of your atherosclerosis, because atherosclerosis is an inflammatory disease. So C-reactive protein will be high. If you have elevated Lp(a), which is not very common, but in some cases, people who have normal cholesterol and have elevated Lp(a), they have high risk of heart disease. The other one is ApoB. And of course, ABI, in which you measure the difference of the blood pressure in your arm versus your ankle, which is an indirect sign of peripheral arterial disease, which is typically in your legs. That means you may have, there's a 40% chance you may have disease in your heart also, or in your brain. So top tips for your heart: do 4 things and make it a habit. It's not about your strength or anything. You just have to make it a habit. It's not willpower. You do it every day, and link it with something you do every day. Like every day, if you have coffee, then just make sure that after coffee you'll go for a walk, or after dinner you go for a walk. Just make it a habit, so it becomes a habit with something that you normally do every day, and then it's going to be something that you'll want to do every day. Now, and by doing this, we know that about 80% of the cases of heart disease can be prevented, 50% of the strokes can be prevented, 80% of the sudden cardiac deaths can be prevented, and 72% of the premature deaths can be prevented by just following these 4 things, but making it a habit. Now, guess what? If you look at the population, how many people are doing this regularly? Only 15%. So I think we have a long way to go, but we can do it together. Thank you. So I'll take some questions. So yeah, calories. So the question was, besides eating a healthy diet, do you recommend tracking calories? Yes, I think tracking calories is important. Portion control is also important. But once you get you do have to track calories when let's say you're trying to lose weight. Then you need to cut your calories down by, let's say, 500 calories every day. So first you track your calories, get how much calories you're consuming every day, and then you cut it down by 500. But once you get an idea how much calories you're taking every day, you don't need to count every day, because it becomes hard to track your calories every single day. So once you learn how to eat, then you don't have to track it regularly. But I would say maybe every few months or once or twice a year, you do want to track your calories, do calorie counts, and see how you're doing. Especially if you have a target, you want to lose weight. But if you are regularly exercising, you're maintaining a good weight, and you're eating properly, then you don't have to count calories every single day. That's it. Okay. So we're finishing up early.